Lieutenant Colonel Steve Contariotis served 30 years in the U.S. Army, including tours in Iraq and Afghanistan. So did all three of his children. He saw and understands what many returning veterans feel both physically and mentally.
One day you're in Kabul or Bagram or in Afghanistan, and the next day you're back in the States. So you don't have a chance to really talk about what you experienced before you're thrust back into the society.
And that's not all they face after returning home.
Nearly half of all veterans returning to this country and presenting for care at the VA had pain problems. A high percentage of these patients also suffer from mental health problems or the invisible injuries of war, such as depression, but in more cases, PTSD.
Dr. Karen Seal from the San Francisco VA Medical Center and co-authors reviewed data from more than 100,000 returning Iraq and Afghanistan veterans seeking treatment at VA hospitals for pain. Researchers assessed who received opiate pain medications and how these drugs affected veterans.
Veterans who had mental health diagnoses, but particularly PTSD, were far more likely than their counterparts without mental health problems to receive opiate pain medication.
The study appears in this week's JAMA, Journal of the American Medical Association.
These patients tend to receive higher dose opiates than their counterparts and would request early refills of their opiates, which indicates that they're using them more quickly than they should be.
Veterans taking opiates had higher rates of adverse clinical outcomes, such as alcohol and drug-related accidents and overdoses, as well as self-inflicted injuries.
When we talk to Iraq and Afghanistan veterans about our concern in terms of their use of opiate pain medication, that often they're very willing and open to try other alternatives to opiates.
Lieutenant Colonel Contariotis agrees. While he understands many veterans do require pain medication, he says connecting with them can also help.
The message I want to send is to talk with the veterans, and don't be afraid to ask them, hey, tell me, what was it like over there?
Catherine Dolph, The JAMA Report.